When should blood transfusions be given in intensive care? That is a question we get quite frequently here at intensivecarehotline.com. My name is Patrick Hutzel from intensivecarehotline.com, and this is another quick tip for families in intensive care. So in ICU or in intensive care units, blood transfusions are given based on clinical need and are guided by evidence-based thresholds. I'll give you an overview today when blood transfusions are typically indicated in ICU patients. So let's start with red blood cells or red blood cell transfusions. They are indicated when hemoglobin, which are the red blood cells, is less than 7 in most critically ill patients without active bleeding or significant cardiac disease. This is supported by the landmark TRICC trial, Transfusion Requirements in Critical Care. Then hemoglobin less than 8 in patients with active coronary artery disease, patients undergoing major surgery or septic shock with evidence of tissue hypoxia, because especially the heart has a high oxygen demand. But also, as soon as there's a low hemoglobin, not all tissue, not all organs and tissue might get the oxygen they need to perform at its best. Acute blood loss anemia with signs of inadequate oxygen delivery, tachycardia, hypotension, low urine output, or lactic acidosis despite fluid resuscitation. Tachycardia means fast heart rate, because the heart is compensating for not having enough fluids, and hypotension means low blood pressure. Next, let's look at platelet transfusions, and they are indicated when platelet count is less than 10,000 to prevent spontaneous bleeding. So the platelets are in your blood to stop the blood from bleeding. So if your platelet count is low, a spontaneous bleed is much more likely. So therefore, platelet transfusion is often given, once again, to prevent spontaneous bleeding. If platelet count is less than 20,000, if the patient has fever or is at higher risk of bleeding, and if platelet count is less than 50,000, even invasive procedure or surgery is scheduled and active bleeding is present. The next blood transfusion that can be given in intensive care is plasma, also known as fresh frozen plasma, FFP, and it's indicated when INR, PT or PTT with active bleeding is prevalent or prior to invasive procedures. If there is coagulopathy due to liver failure, DIC, which stands for disseminated intravascular coagulation, or massive transfusion requiring correction of clotting factors. And coagulopathy is basically a condition where the blood's ability to clot is impaired, leading to excessive bleeding or abnormal clot formation. FFPs can also be given for plasma exchange in certain conditions. Next, cryoprecipitate is indicated when fibrinogen is less than 1.5 in bleeding patients, or in DIC, once again, disseminated intravascular coagulation, massive transfusion, or liver disease with low fibrinogen. Next, there are massive transfusion protocols in ICU, which are triggered when there's an ongoing massive hemorrhage, often defined as 10 units of red blood cells in 24 hours, 4 units in 1 hour, with anticipated need for more. And this I've seen many times in ICU after multi-trauma, when patients come in to ICU and are bleeding heavily. What are other considerations for blood transfusions in intensive care? Individualized decisions consider clinical context, comorbidities, i.e. cardiac disease, and physiological signs of poor perfusion. Risks of transfusion include transfusion-related acute lung injury, infections, volume overload, and immunological reactions. So that sums it up. I hope that answers this question that we get quite frequently. Now, I have worked in critical care nursing for over 25 years in 3 different countries, where I worked as a nurse manager for over 5 years in intensive care, and I've been consulting and advocating for families in intensive care since 2013 here at intensivcarehotline.com. And I can very confidently say that we have saved many lives for our clients in intensive care. And you can verify that by looking at our testimonial section at intensivcarehotline.com, and you can verify that on our intensivcarehotline.com podcast section where we have done client interviews. Because our advice is absolutely life-changing. You know, when families work with us one-on-one, we change their lives, we improve their lives instantly because our insights are invaluable. You know, the biggest challenge for families in intensive care is simply that they don't know what they don't know. They don't know what to look for. They don't know what questions to ask. They don't know their rights, and they don't know how to manage doctors and nurses in intensive care. And that is exactly what we are helping with, to improve your life instantly so that you can make informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment always. And you can join a growing number of members and clients that we have helped over the years. And that's why I do one-on-one consulting and advocacy over the phone, Zoom, WhatsApp, whichever medium works best for you. And I talk to you and your families directly. I handhold you through this once-in-a-lifetime situation that you simply cannot afford to get wrong. And when I talk to you and your families directly, I also talk to doctors and nurses, case managers, social workers, nurse practitioners, whoever you want me to talk to, and ask all the questions that you haven't even considered asking, but must be asked when you have a loved one critically ill in intensive care. We also do medical record reviews in real time so that you can get a second opinion in real time. We also do medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are suspecting medical negligence. I also represent you in family meetings with intensive care teams. We also have a membership for families of critically ill patients in intensive care. And you can become a member if you go to intensivcarehotline.com, if you click on the membership link, or if you go to intensivcaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in the membership area and via email. And we answer all questions intensive care related. As a member, you also have exclusive access to 21 ebooks and 21 videos that are only exclusively accessible for our members. And all of that you get at intensivcarehotline.com. Call us on one of the numbers on the top of our website, or simply send us an email to support@intensivcarehotline.com with your questions. And if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, comment below what you want to see next, what questions and insights you have, and share the video with your friends and families, or with anybody that has a loved one in intensive care. I also do a weekly YouTube live where I answer your questions live on a show, and you will get notification for the YouTube live if you are a subscriber to my email newsletter at intensivcarehotline.com, or if you are a subscriber to my intensivcarehotline.com YouTube channel here. Thank you so much for watching. This is Patrick Hutzel from intensivcarehotline.com, and I will talk to you in a few days. Take care for now.